first, there's the penis. We have penile neurotoxin, which I've coined Grotox. It's tox for growers. And then there's penile filler, which I've coined P-girth, and it's just for girth enhancement. And then in terms of the scrotum, we have the analogous, where we have tox, which is Scrotox, to allow the scrotum to hang a little bit looser, and then grow, and that's basically enhancing the size of the package with filler. And then we have Rimtox, which is anal toxin, and it's just for relaxation to enhance penetrative anal sex.
So normally in our masterclasses we talk about products, but this time we're going to be talking about techniques. So this is a different type of masterclass to what we normally do. So
I'm sure, and John will tell us more around products he likes to use for this. These different procedures, and maybe I don't know if you've used different toxins for different sort of niches within this area as well, so we'll get into all of that.
Obviously, these treatments that you're offering, they're not just aesthetic, they're functional. So I guess in your consultation, maybe even your pre-consultation, your marketing, how do you cater for the psychological side of things? So, you know, you may get some people there pretty distressed about how things look, and you may just get people who want to spice up their sex life. So it can be a difficult consult, I'm assuming.
Sure. It's all about our intake. And the first question is, would you like to improve upon your appearance or your function? All right, so if it's appearance, then we can use filler to really augment the penis, make it thicker. We can also use neurotoxin to allow the penis to hang longer in the flaccid state. So in terms of function, we can improve endurance. Tox and filler can be used to treat premature ejaculation. And then also tox can be used to improve erectile function. So that's how we kind of screen the patient. Sometimes it's one or the other or both. It just happens to be during the course of the consultation where I kind of feel the patient out, and sometimes they come in with a lot of anxiety, sometimes even shame and embarrassment, and it's up to me to kind of like delve into that a little bit deeper. Like, do you feel embarrassed about yourself? Did someone insult you? And I gain a little bit more insight in terms of what I need to do for the patient.
Do you work with any psychologists, or maybe you say no to some people because you think their expectations are just, you know, not going to be catered for by what you can offer them? And how often do you have to say no, I guess is my question.
So I don't work with a psychologist, but sometimes I wish I did. But for the most part, there's high patient satisfaction when I do penile filler. And I feel like I can make just about everybody happy. However, there's always going to be that one that no matter what you do, they're unhappy. And I think I have like maybe one or two patients that kind of fit that description. But for the most part, you know, it's like they see my body of work. I talk them through everything, the reasoning why I do things, and I gain their trust to undergo the procedure.